Before going to the topic, we will see about the guidance and counseling. Some introduction about some of the gestures is very important. Especially when the counselor, her gestures should be I must lean forward, sit. You sometimes it is needed to touch the patient's shoulder, console him. Sometimes you have to be a good listener. So if the listening capacity is there, half of the problem will be solved. So once they ventilate, and you have to give the eye to eye contact, and also nodding your head, and keeping sometimes silence when they are crying. Just you keep silence and put your hand into their shoulders, and don't give always suggestions. Motivate them to list what are all the plans, what all the opportunities are there for them to write it. So once they are going to finishing, okay, summarizing and paraphrasing is very important. Once you summarize and paraphrase, the client will be very happy that you have. It shows that the counselor listened very carefully. And the beauty of group counseling, many will be ventilate their feelings. If you see the school guidance and counseling, this man is giving the guidance. He found out that one child having a problem. Okay, then he has taken separately from the group guidance and started to give guidance and counseling, but he is not eligible. He is referring that child to the good counselor. So counseling is not the mental problem. It you have to solve the issues so that the child can keep a very good environment. We'll see clearly about guidance and counseling. Guidance is a process helps an individual to develop his personality and enable him to serve the society to the best of his capabilities and talent. Overall, guidance helps the individual to adjust with the environment. What is environment? Environment may be a influential positive environment or negative environment. Who is the person? Person or the individual is a social animal. He could be able to cope with that. In this class, we will see clearly about what is the purpose, what is the types of counseling, who can give guidance, who can give counseling, what are all the qualities of a counselor, and as we have introduction, we have seen what are all the position, how your body language, gestures, that and all will be coming under the qualities. We can see clearly. The guidance when it is needed. Guidance does needed from the birth to death. Who can give the guidance? There is anything, no specific one. Anyway, your guru can give a guidance, or your beloved friend can be given a guidance. For example, when we encounter the people, when we are talking to some people, some will be telling, Madam, when I talk to you, I feel so ease. Same way, if you phone someone, you talk, you will be depressed for the whole day. Whatever you tell them, yeah, I'm going to do, my plan is this one, X or Y, this I'm going to do. Then they will tell negatively. If you do, you will do. If it is failure, what will do? No, I will overcome. This one, what will do if you do? So those kind of the people, you should avoid getting guidance. There is a little difference between the guidance and counseling. It's nothing but when the person is going continuously getting a guidance, he does not need any counseling. So what is the difference? Guidance is throughout the life somebody is guiding. Counseling is does need any problem solving approach. It is needed by the sum of the specific counselor is needed to solve the problems. So when the individual or the social animal adjusts with his environment, he does not need any counseling this one, because he himself adopt with the environment whom to talk, whom to avoid, whom he talk, his mental health and emotional health will be good, and he adjust with the environmental people, either the avoid to avoid or accept to accept, or some people he will avoid and make his mental health correctly. So in this class, counseling means what? Guidance we have seen. Counseling is the essential process which is the counselor assist the counselee to make the interpretations of facts relating to a choice plan adjustment with the need to make. See, understand the definition. Interprets the facts relating to the choice and plans. He is not supposed, he is just to assist. The word assist is very important. Counselor is not going to force any of the solution to the the client. So counselor has to tell this is a plan number one, plan number two, plan. The important main qualities of the counselor, he is what's that is saying counselee to make interpretation. When how do he interprets? He will ventilate his feelings. He will tell about his facts. What is the counselor role, main role? You will be thinking that counselor role means giving extra why or ideas. Nothing. The listening is an important qualities of a counselor. How to listen? That immediately we have seen. In the beginning of the class, we have seen nodding, listening, eye to eye contact, touching, shoulder. All these things is important. If he listen carefully what he is speaking, half of the problems will be solved automatically once he ventilate his feeling, then he will be asking what to do. Then you have to insist, you just assist him. He will take the plan of action. What I have to take, sir? Okay, sir, I will take this choice. So you must remember, as a good counselor, you have to remember this point. Yes, first we will start with the guidance. What is the purpose of guidance? To understand the individual and help the individual to make the adjustment. If anyone having adjustment problem, coordinating the home, school and society, the time management, how he can overcome when the home, when he come back from the school, again the school work continued in this one, tuition, extracurricular activity, co-curricular activity, dance, Hindi class. So does completely the child need a guidance from the mother, parents, right or not? And carefully study the individual and improve the school activities and information services and counseling, to give counseling if at all does need, any problem is there, the child is not ventilating to the parents. So that time it has to be with your guidance. You cannot solve the problem, you have to send it for the counseling. Then placement and follow up. For example, child is studying, how to get the placement and assist the school staff and coordination. What is the main objectives of guidance? To make the individual aware of their own interest and talent, strength and weakness. What we do, our parents, no, my dream was to become a doctor, but I couldn't. You become a doctor. No, cannot be. So you have to identify what is their interest, what is their talent. Don't impose, while as we are guiding, as a parent we are guiding. Don't impose anybody's ideas, views into the children. That's the main thing. To help the individual to develop their own abilities and interest and their own skill. Help the individual to their all-round development. And to create awareness among the individual. What is the awareness you will give? Education is how important. Vocational awareness. What is the opportunities that you will be giving? If this is the objectives of counseling, what is the objectives of counseling? Counseling also helps to understand the selves and making the impersonal decisions. Personal decision will be help the individual to take the decision, cope with the different situations, to establish the mutual understanding and between the students and the teacher, and encourage the student to develop the special abilities and right attitude, to assist the students in planning the educational and vocational plan or vocational choices, what course he will be taking further, like that, and to help to solve the employees problem is in an organizational counseling, to support the employees on the self-confidence and the self-direction. Who is the employees? Who is the organization? What is organization? Organization is a group of individuals working together in order to achieve the common goal. How the group of people will be there? One good people will be there, one positive person will be there, one negative person will be there, one appreciating manager will be there, or the manager will not appreciate. Sometimes the partiality will be there, bias will be there, but we have to adjust. So we have to adjust. So that's need counseling. Or if it's the friends are there, they may take the guidance. Okay, let us come back to the guide. This is the main objectival difference between the guidance and counseling. What is the types of guidance? So you can give the first and foremost is educational guidance, social guidance, then will be the personal guidance, and will be vocational guidance. Okay, this is the main type, social, vocational. But in case of counseling, like I told, what is organization? It's like organizational counseling, individual counseling, then career counseling, family counseling, and grief counseling. So family counseling, you can see any family court, there will be a family problems will be solved, and the issues they will go to the counselor. Family counseling, the judge will be telling, before going for divorce, go for the 1 or 2 sessions of the counseling. Grief counseling, sudden death of someone's spouse, sudden accident they met. So mentally they are not prepared for their death. Sudden accidents or sudden disaster or natural tsunami or anything take away their life, we need really grief counseling. Okay, what is the characteristic of counselor? It is very important. As I told, she should be a friendly nature. More than sympathetic, he also should be sympathetic and understanding, and will be sincerity should be there, patience should be there, tactfulness is there. Sometimes patient will be going on, will be talking, and tactfulness should be there, and ability to maintain the confidentiality. This is very, very important in counseling. The patient is telling the foremost personal problems with him, so you should never leak out those particular problem until if at all it is needed for some criminals or the medical legal case or something is exceptional. Otherwise, you should maintain the confidentiality. Respect the client's attitudes and the needs. Speaking of the client's language and trusted. So same language person giving counseling, it's very good for the client to ventilate his feeling. The qualities of the counselor is very, very important. What are all the qualities of the counselor? He should have a good, we can write like this. Good counselor means we can see, easy to remember. Good technical knowledge and obtaining the information from the client. How to obtain the information? If you keep quiet, You give your gestures, positive gestures, lean forward, look at their eye contact, nodding your head. All these things will make the patient to ventilate its feeling. Objectivity, answering the questions and demonstrating the professionalism, confidentiality maintenance, and the observant, unbiased, non-judgmental. You should not tell, yeah, you are wrong or you are right. Don't judge. Just observe and listen him, nodding your head and sensitive to the need of the patient, and be empathetic. Listen carefully and let the client make the decision. You just give A, plan B, plan C, and then let him. You can tell even what is the plan one have a consequences or anything. You can tell. Open-minded is very important. Respects the rights of the individual. He has the rights. Maybe he want to, sir, excuse me, sir, I don't want to continue with the counseling with you. You have no right to force him. You have to just leave him. Then skills in counseling, like building a rapport, attending, reflecting, paraphrasing. Yeah, he's telling that, okay, so you were living 1 year and this is what the problem had happened. So this continuously, every incident that togetherly you have planned like that, you have to paraphrase and summarize, questioning, focusing, immediacy. Immediately you have to respond. Sometimes you need to silence. It's very essential. Every time counselors should not be going on talking or nodding. Sometimes you have to make if he is crying, be silent and let him cry, ventilate. And connecting. Oh, that is the one. Yesterday you told this one. Okay. Last session of counseling you told. So you have to respond and should be, as I told you before, it should be a non-judgmental. So the skills of the counseling is very important. What are all the steps of counseling? First is a relationship building. How you build your relationship? You can shake the hands and introduce yourself. Past, I am the counselor. You tell about yourself, and then patient will be, he's respecting me and telling a counselor telling detail about me. Then he will then you let the patient will tell about himself. Then you assess what are all the problem and diagnose, and then will be goal setting and intervention and problem solving. Intervention will be, you don't implement any intervention. You just tell plan A, plan B, plan 3. Then client will be choosing his own this one. And then termination and follow up. Sometimes research and evaluation. You can take it. Then main goal of the counseling. The goal of the counseling is like facilitate the behavioral change. Once the suicidal tendency is there, so the behavior will be changing, and then enhance with the coping skill, promoting decision making and improving the relationship, facilitate the client potentials. You need counseling, improve the relationship, husband and wife, family counseling will help improve the relationship between the partners. Overall, there are various different types of counselors are available in a different areas. As I told, there are various positions will be available, counseling position. One is the recreational therapist. Recreational therapy is always the parents are study. The child may go for the depression. So some counselor will be telling somebody to okay, send your child to the recreational therapist. Career counseling. So you need to go for the career counseling. They will tell about X or Y with their plan 1, plan 2. These are new courses, these opportunities. And then sometimes behavioral therapist. Some of the children will be having a behavioral problem, so like sexual disorder, sometimes behavior, or some other behavioral disorders will be there, so that habit or something. So this mental health counselor will be there. Rehabilitation counselor. Rehabilitation, for example, one of the boy in when I was teaching for the NIVH, the boy was studying the engineering college. He had a retinal detachment, so they told that before entering into the 4th year you will be totally blind. The boy, there is no treatment, so he has to adapt mentally what to do. So he has to go for the rehabilitation center, or he has to go and adopt with that. So that time you have to give rehabilitation counseling to how you can effectively live with a low vision, or he has to train them how to walk with a low vision one itself, how to use the stick and other thing. NLP, neuro linguistic program. So these people will be changing our mindset, that they have come on 2-3 days therapies they will be taking. So they will be, and family therapist will be there, how the family counts. So we are seeing about what is guidance and counseling. What is the difference? You can see the difference. It promotes the individual development. Counseling is a problem solving. Is the beginning I told you, is any problem, guidance continuously, any one child is getting guidance in his lifetime, no need to go for the counseling. It's a problem solving approach. It's a much more extended one. Anywhere anybody can be given. It is more inward analysis. It's going deep into the problem, find out the root cause of the problem, but it is like outward. It's not specific, it is generalized. It is so specific towards the problem. It is preventive and developmental. So that's what I told you. When you get continuous guidance, you don't need to go for the counseling. It's a preventive aspect, is a counseling. Then it's a remedial as well as a developmental. Remedial means already you are traumatized by some problem. You have to come out, you have to go for the counseling. I tell you something, in my family itself, I told my sister, "Ye, you are so much stressed, you plus best you go to for a counselor." She started shouting. She studied a master's degree, but she asked me, "Do you think I'm a mad? Do you think I'm a mentally affected? I have to go for counseling." No, that is a myth. It's a counseling. Going to the counselor, it is not you are a mentally ill person. It is a myth about the counseling. You go to the counselor, you are a mentally no. Anybody, any traumatized situation come, you go for 1 or 2 sitting counseling, that will be better. It is not a mental issue, or once you go to a counselor, you will not be stamped as a you are a mentally ill client. Never. So that myths has to avoid, so that it will be peacefully they can lead their life. It has a personal and social, educational, vocational health guidance is available. But here is a directive counseling approach, non-directive and eclectic approach. Directive half and non-directive together with the eclectic approach. It is mainly by the verbal communication, written document involved. Here will be gives the importance for the non-verbal expressions, emotions, gestures, all will be noted here. No specific steps and process will be available. Here will be it has the specific steps and the process will be available. Anyone can give the guidance, like a parents can give, and the teacher can give, grandma can give, or the guru can be given, or elders can be given, sisters can be given, your best friend can be given a guidance. So you are depressed, why you are, that's what in the beginning I told you. Some people, if you are talked, you feel very ease in your mind. Some people you will be talked 2-3 days, you cannot sleep because their negative words will be affect you. What is the it requires the special trained person to give the counseling. It's like especially doctors, medical doctors, psychologists, psychiatrist, or nurse also can be given the guidance. Counseling. No need for maintain any confidentiality. In public you can give, or in front of anybody you can. Here will be strictly maintain the confidentiality. Not require any special physical setting is necessary. Any place you can stand or you can give, or through phone you can give. It requires the special setup to maintain the confidentiality. Not very specific to maintain the good IPR. Here will be very good IPR is very important. Interpersonal relationship. No technique is required to give guidance. Here will be required technique like reassurance, okay, and then problem solving technique, reflection technique, summarizing, feedback, rapport building, goal setting, record maintenance. All this is very essential for this giving guidance and the counseling. What is so we have learned about what is the guidance and counseling. Here some model. If you see this model, here will be counseling theory. This is a counseling intervention. In this pyramid, you can see this, how this one is important for the counselor. This one, that what you will be telling is genuineness, empathy, and unconditional positive regards, ethical behavior should be there. Open or closed question you have to ask. Basic attending observation skill is very important for the counselor. Reflection skill is very essential for them. So, if remembering all genuineness, empathy, unconditional, multiculturalization, understand their culture, behavior, psychology, their body language, gestures, everything, you give attention and everything. So, you can give the good counseling intervention. If you give counseling intervention, counseling theory, what theory you have to apply? It is according to the person, the theory you can apply. What is called counseling theory? There are many theories are there. So, you can apply those theory. How to apply? With your behavior. So, you have to apply with the counseling intervention. You can help the individual to come out with the problem. So, what is all counseling theory? For example, psychoanalytical theory. So, psychoanalytical theory, feeling driven from the unconscious mind. For this one, for example, I tell you, some of the one child they have brought it, 121-year-old girl. They told that she doesn't like any men. She don't want to get married. What is the problem? Any traumatizer? No, nothing. So they were like analyzing, anything. Then they made the child and they asked the embryonic history when the baby was inside the womb. What happened? So they were telling this is the 4th female child. Father doesn't like. The father was telling her to do abortion. The time she conceived itself, we didn't determine the sex. Already 3 child is a female. This may be a female like that. I was so much afraid and panic. Every time my husband was fighting with me. So you see that one, it is affecting this one. So feeling driven from the unconscious mind. So it is affected her unconscious mind. Right or not? The feeling and emotions of the pregnant woman affecting the baby. Okay. So that one has to be psychoanalytical theory, that you have to mindset, you have to analyze the psychology, and that mind has to be changed. And the behavioral behavioral therapy. So behavioral theory. Cognitive is like a psychological or emotional theory. Humanistic and holistic approach. So you will take some of the good concept from the behavior theory, psychological theory, and apply into this. It is called the holistic, this one, person-centered theory and positive psychological theory. So any conspiracy theories or any theory you can apply into that, and using the basic skill is more important skill: genuineness, empathy, unconditional bias, non-bias, positive approach, ethical behavior should be there, basic attending, observation skill, reflection, all these techniques. By using these any theory and keeping the counseling intervention, if you implement these intervention by your basic good qualities of the counselor, any client will come out from the problem. So that is the main importance and the success of counseling. Hope you have understood about the definition, purpose, types, what are all the different types and skills of counseling, difference between the guidance and counseling, what is the model of counseling, and what all the different positions, for the different positions are available for the counseling position, and steps of giving counseling. If they are asking you about the steps of counseling, you just write these steps and write inside how to build the relationship, how to trust, and then assess and diagnosis, how you will assess verbal and non-verbal, what they have, and then goal setting. Goal setting is a participatory with your client and the counselor. Then intervention never implement, and let them take their intervention, ask them to keep quiet, and problem solving. And once the problem has been intervention taken by them, they will select themselves and solve the problem. Then termination phase, you no need to do, and follow up you give them. If they want that the follow up any problem, they will come. So you no need to go and probe, and always you have to terminate the relationship. If what happened, what is happened to your false relationship, you kept nothing. If they want, they will do come for the follow up. This one, research and evaluation, you can use for the client data, but that should be very confidentiality. You have to change the name and address and other things. You have to take only the content. Okay, thank you.